morning to our witnesses here today, and I want to welcome everybody to this morning's committee meeting. Some of our members have been detained. There have been there's a few other issues that they're detained at, and they intend to be here shortly. As you can see, we've already gathered 3, and there's a few more to come as well. And but I want to say that you're very, very welcome. We're in public session, and we're with Sarah O'Toole and Lars Buzelman and Dr. Mary Keogh of Christian Blind Missions. And as I said, I wish to extend a very warm welcome to all of you here today. And I would like to congratulate Christian Blind Missions on their work in protecting the human rights of people with disabilities around the world, and your advocacy on their behalf. I think it's really important, and it's so important that we have you in here today to tell your story, because it's a very good news story. Today's meeting is timely as far as the recently adopted Sustainable Development Goals have mentioned people with disabilities in a number of explicit references, and we look forward to hearing more about that in your presentation here this afternoon. Again, the format of today's meeting will be an opening statement before we go into a questions and answers session. And I was delighted to hear that some of your members as far as Australia saw our press release yesterday, and it's good to see that we're being listened to far and away as well. So before I go into private session or public session, I want to remind members, I am in public session, sorry, before we start, I just want to remind members and those in the public gallery to switch off their mobile phones, ensure that they're completely switched off for the duration of the meeting, as they do cause interference even in silent mode with the recording equipment in the committee rooms itself. Also, I want to remind members of the long-standing parliamentary practice to the effect that they should not comment on, criticise or make charges against any person or body outside the Houses or an official either by name or such a way as to make him or her identifiable. By virtue of Section 17(2)(l) of the Defamation Act 2009, witnesses are protected by absolute privilege in respect to their evidence to the Joint Committee. If they are directed by the Chairman to cease giving evidence on a particular matter and to continue to do so, they are entitled thereafter only to qualified privilege in respect of their evidence. They are directed that only evidence connected with the subject matter of the proceedings is to be given, and they are asked to respect the parliamentary practice that, where possible, they should not criticise and make charges against any person or entity by name in such a way as to make him or her identifiable. Okay, so without further ado, I call on, I think it's Sarah that's making the opening statement here this morning. And again, can I say you're most welcome.
Chairman, can I just apologise in advance of the meeting that I have to go at 5:30.
Okay.
Very sorry. It's just one of these unique occasions. I must.
Okay, we understand that.
Apologies.
Yeah. Okay, we'll get you in first. Okay.
Well, good morning, Chair and committee members, and first of all let me extend our gratitude and thank you for inviting us to present to you here today to talk about the Sustainable Development Goals and the impact of them on people with disabilities, and also the impact of Ireland's overseas commitments in its Overseas Development Aid programme. My name is Sarah O'Toole. I'm the CEO of CBM Ireland, and with me today we have Mr. Lars Buzelman. Lars is the Director of Advocacy for CBM International, and on my left Dr. Mary Keogh, who is a board member of CBM Ireland and also the advisor on advocacy and policy for both CBM International and CBM Australia. I will just give a brief introduction about our organisation. Lars will talk about the Sustainable Development Goals, and Mary will talk further on Ireland's commitments to people with disabilities through the SDGs and our Overseas Development Programme. As you probably know, 1 in 7 people today in the world are living with a disability, and that equates to 1 billion people, and they are the world's largest minority. CBM is an international development organisation committed to improving the quality of life for people with disabilities in the poorest countries in the world. And we do this in a number of ways. We are working currently with nearly 500 partner organisations in 65 countries throughout Asia, Europe, Africa, Latin America and the Middle East. And we work with these partner organisations to deliver medical services, healthcare, community-based rehabilitation, education and livelihood opportunities for people with disabilities and their families. And then in times of conflict or natural disaster, when an emergency occurs, we ensure that the rights of people with disabilities in these situations are not forgotten. And there we partner with local organisations on the ground to ensure access to emergency relief and supplies for people with disabilities. And then in terms of our advocacy work, both here in Ireland and internationally, we work to ensure that the human rights of people with disabilities are met. And both in development policies and programmes, and we are working with governments, state agencies and other development organisations to ensure that we meet this goal. I'll just briefly now hand over to Lars, who will talk further on the Sustainable Development Goals.
Yes. Thank you, Sarah, and good morning to all committee members, and thank you again for the kind invitation to speak before the committee. As said also by the chair of the committee already, in contrast to the Millennium Development Goals, the Sustainable Development Goals that were recently adopted and will be in place for the next 15 years include a number of specific references to the rights of persons with disabilities. I'll start with making some thoughts or reflections why that actually is important. Why has the disability movement fought so hard over the last 3 years almost to get actually inclusion and recognition in the SDGs for the rights of persons with disabilities? Now, these kind of global frameworks, of course, they set and agree priorities for a long time. So once you are in, or once a topic is in, it's much easier to argue that it's important, whereas when you are out, as it happened to disability in the MDGs, it's almost impossible to talk to decision makers, officials and other people, because they will say, yeah, that's definitely an important cause, but actually it's not part of the globally agreed agenda. So it will always stay then as sort of a side issue. And that we had faced very much with the MDGs, and we are extremely happy that with the SDGs, that has now the potential to change. Secondly, they are in place for a long time. So they are in place for 15 years. So that's so important why you have to be there from the beginning, because you are there for the next 15 years. And if you are out, as it happened with the MDGs, then you are out for 15 years, and it's very difficult to rectify during the course of the implementation of such global frameworks once they are agreed. The third point, very obvious, I guess, those global frameworks, they determine to a large extent where the money goes. Otherwise, why would we set priorities? So if you're not part of the agenda, then again, the money will not be spent on the cause you're defending. And the last point that I would like to make also, if you're not included in an agenda such as the MDGs or the SDGs, what happens then also, what is not in is not measured. And there again, with the SDGs now, the big advantage is disability is included, it is there, so it needs also to be measured, it needs to be reported, it needs to be monitored. And that is also one of the huge achievements that we see, or at least potentials that we see that the SDGs will bring. And let me just for a second explain a little bit more on the measuring aspect. The exclusion of disability in the MDGs led to a situation where in 2015 today, we actually have a fairly weak body of evidence on disability. There are good examples, there are country studies, there are case studies, there are some good research pieces here and there, but overall, we actually have a fairly weak body of evidence and a weak picture of knowing how many people with disabilities do live globally, and also where do they live, what are their needs, and what also are the needs to include people with disabilities in different sectors such as education, jobs, and so on. So now that is why it's so important that we improve the collection of data, that we actually have data available on knowing where do people with disabilities live, what are their needs also, and how can policies better address the rights and needs of persons with disabilities. For that, we need a much better base of data and evidence than we currently have. And this is one of the huge achievements of the SDGs, that this data disaggregation, which is foreseen, which is actually there in goal 17, for those who want to have the precise reference, that we make this reality and that we make this real in the implementation. Last point, implementation has already been mentioned. Of course, the SDGs, as all global frameworks, are only as good as we make them and as good as we make their implementation. And there, it's very important, and we all have a role to play, whether it's civil society, whether it's US parliamentarians, governments, and UN agencies, and all together, to actually live up to the high expectations that they have raised as well. But we have to be honest there, that's not only true for disability, but that's also true for many other causes. Of course, expectations are high, because we are included this time, but we also want to see, of course, progress in implementation, and not only in the document. And therefore, it's important to look at monitoring. It's very important to look at how to translate those global goals to the national reality. And it's also very important to really look at the indicators and how to measure it. And in all of that, you as parliamentarians, together with many others, you have a role to play there. And Mary, my colleague, will now say a few more words on how concretely, some thoughts and suggestions from our side, what concretely you can do to make those goals for persons with disabilities reality.
Thank you, Lars, and thank you, committee members, for the invite. I'm honoured to be here. I'll speak briefly about the Irish context. Lars spoke about the international context in terms of the SDGs. The Irish government over recent years on Irish Aid have made significant progress on the inclusion of people with disabilities in Ireland's overseas programme. The briefing paper in front of you goes through that in detail, so I won't allude to that at the moment. But it is fair to say that the CRPD, the Convention on the Rights of People with Disabilities, is largely driving the commitments that the Irish government is taking around inclusive development. And I know the Irish government also has a roadmap now set out for the ratification of the CRPD in the coming future. The significance in terms of the policy of One World, One Future from, I suppose, a leadership approach around disability is that it's a very progressive document which commits the Irish government to devoting more resources to achieving equality for people with disabilities. And we're delighted to see that Irish Aid is delivering on these important commitments to people with disabilities in the developing world in areas such as human rights, public services and livelihoods. And also we acknowledge also the parliamentary questions that have been discussed over recent times, which have given increased visibility around people with disabilities with regard to the overseas aid programme, and the commitment within that in terms of looking at Ireland's role of ensuring that the implementation of the SDGs is inclusive of people with disabilities. I think at this moment in time it's a crux time, because we're at one of the first times ever where we have foundations with the Convention on the Rights of People with Disabilities and the SDGs to actually move forward and advance the human rights of people with disabilities living in some of the poorest countries of the world. So we strongly urge the committee in its regular review of Ireland's overseas development aid programme and in the future progress reports on sustainable development goals to look at how the measurements are specifically impacting on people with disabilities. And Lars alluded to that with regard to the data issue and the monitoring. And we also would like to see the continued engagement. We've had very good engagement with Irish Aid over recent years through CBM Ireland and also through our coalitions with the DOCUS Working Group on Disability and Development. And we'd like to see that continue, and we are endeavoured to work in partnership on making sure that we can support an inclusive international development programme that's inclusive of people with disabilities.
Okay, thank you very much indeed. I know Deputy Byrne wants to go, so I'll let him in first.
My apologies for being late and my apologies for leaving early. But just to congratulate you for being here and thank you for your contribution. I've left my documentation, which is quite substantial, having read into it upstairs, because it's on my file for future reference. Can I thank Mary for thanking the government in its efforts to fine-tune its overseas development aid programme through Irish Aid. I suppose I have a lot of experience of Africa, having lived there for four years, disability, and when you look at the Western premier countries, like how we treat, or the facilities we have in the West to treat people with a disability, really, when you compare it with the ability of, say, those with disabilities in Sierra Leone or one of these other countries that's come out of war, and the indigenous illnesses there from the effects of malaria, which can have damaging effect on the brain. Blindness, I remember the Maasai people used to put stuff in their hair, and I think it was cow dung actually, and blindness was a huge problem for the Maasai. So when you compare the society's abilities to treat as equals those with a disability, we have greater prospects in the West. And that's why the importance of the Sustainable Development Goals are of key, because that's an international commitment to treat everybody as an equal citizen of this world. So just want to congratulate you and keep up the good work, and my apologies yet again for having to leave.
Okay, I'm bringing Deputy Neville now as well, okay?
From you as well, and thank you for your contribution. It's a very important area. It's an area that has been neglected over the decades, because those of us who have travelled to third world countries with Irish Aid have seen some examples of this. And I would just like to raise two areas in particular with you. One of them is the area of intellectual disability and the treatment of intellectual disability in developing countries, or and Irish Aid's approach to this. You know, there's a global sort of thing that we have to look at disabilities and ensure that disabilities are included in SDGs and so on. But when people think of that in a global way, or in many of those countries, they think of physical disability more than intellectual disability. And I think that maybe from our history we could see a development going back some decades in relation to that ourselves. So we can't, this is not unique. It would have been in the Western world maybe 100 years ago, or even less than 100 years ago. And also the area of mental illness in those countries. While mental illness is an illness and not a disability, but it's often included with disability and the treatment of mental illness, and sometimes falls between the two stools of disability and physical illness. Because of the interpretation. But strictly speaking, and sometimes people group intellectual disability and mental illness, which of course intellectual disability is not an illness, it's a condition. There are two areas that maybe you would examine. The other thing is there are other countries as well where I've seen very extreme neglect, if you want to call it, of disability. And I just want to mention, I don't know how you'd respond to this, India. You see, people with disability on the streets, and because of the caste situation in India. And I've seen very, very, very upsetting situations on streets with people with extreme disability begging and trying to survive, and obviously being totally neglected by any system. It would appear, maybe you would clarify. I know it's not maybe strictly in the area of the third world, but India, maybe we would argue that point. But it is very present, and the cultures of some country has a bearing on the neglect of people with disability and mental illness. So some short address, and that would be
okay. Now I think Senator Mullins, you want to go to the Shannon, do you? Do you want to come in now? So you don't mind Deputy Crowe if we get him in now, because he wants to go to the Shannon. Okay.
I must just want to thank you very sincerely for your presentation, I think, which was extremely positive, and obviously the fact that disabilities and that are included in the SDGs obviously is very significant for your good selves. I briefly read through your presentation, and obviously you're doing very significant work in some of the most troubled parts of the world. In relation to Irish Aid, what level of support are you currently getting from Irish Aid, and how has that progressed over the last number of years? Obviously, given the humanitarian situations, it has worsened in some parts of the world, and your your plans and your ambitions for 2016. What are your main objectives for 2016, and what are the most difficult challenges that you're facing? Thank you.
Okay, I'll get you to answer some of those questions. Senator Mullins asked there about the level of aid from Irish Aid. Maybe you could tell us a little bit about those projects.
Yes,
I think that would be something that we would appreciate to hear. The support and the projects, and what type of projects the aid and yourself work with. Thank you.
Of course, Chair, and thank you, both deputies, for your comments and your questions. In relation to our current support from Irish Aid, we've partnered with Irish Aid for a number of years, and currently we are co-funding a project with them in Goma, which is in Eastern Democratic Republic of Congo. And this is a very significant programme for us, because we are looking at community-based rehabilitation, which is focused on providing access to services for people with disabilities, but also ensuring the participation of people with disabilities in providing those services. And this is a significant leap forward in how we deliver our development programmes. This project is focused on orthopaedic care. So it's sometimes misleading when you talk about the Christian Blind Mission. That's why we talk about CBM, because our kind of founding services were around eye health, but we now look at both eye health, ear and hearing care, physical disability, mental health, intellectual disability. So we cover the whole spectrum of disability. And we see poverty as a cause of disability, and disability as a cause of poverty in these communities that we work in. Irish Aid in 2015 gave us funding to the tune of €51,500 for this project that we have in Goma. And it's a project that we are hoping to build upon. We are currently a recipient of Civil Society Fund grant from Irish Aid, and we very much welcome that. And this programme is really providing us, an important part of it is with providing us with good data around how we can better provide our services, and giving us a measurement of how the programme is performing, and we're very committed to that. A significant part of that programme is that we also look to fight the stigma of disability, and Deputy spoke about culture and beliefs around disability. And so we have a group of community workers within that project who are trained, and they are people with disabilities themselves, and they go out to the communities to talk about the project and to encourage people to come forward for services and participate. So it's a very important project for us, and that's the programme we have with Irish Aid at the moment. We're obviously hoping next year to build upon that and to work more closely with Irish Aid to look at disability inclusive development in the broader sense, and how we might assist in developing and enhancing programmes to ensure that people with disabilities aren't left behind.
Okay. Dr. Keogh, do you want to come in?
Yeah, I mean, I could also just maybe give an example of a project that CBM has in Ghana, which has looked at working with people with mental health illness and looking at how to improve their integration into the community, and this is very much done through a self-help, as Sarah spoke about, self-help and empowerment. So that would be a big focus of CBM's work in terms of working with people with intellectual disabilities and mental health issues. And that has seen real benefits for people in the community, where they've developed into running their own businesses, gaining acceptance from other community members, and also becoming involved in a stronger movement within their local area to hold decision makers to account. So that has been quite a successful project.
Okay, Lars?
Happy to add one aspect also in response to one of the questions. It's very important for us also for CBM internationally to see ourselves and the cause of disability not just as a theme that we are concerned with and working on, but that to see this as part of a broader movement, towards human rights and their realization. Because the one aspect that was mentioned, there are many other groups of the population who are not as such, who wouldn't kind of qualify from a medical point of view as persons with disabilities, but who are marginalized, excluded from their communities or societies. And it's very important to us that we exactly fight for the same rights for everyone. Of course, we focus on disability also in our project work, but we do this clearly from a human rights point of view and perspective, and also the already discussed and mentioned SDGs call on all of us, including CBM and civil society, to see that bigger picture and to work on it comprehensively, and we try to move in that direction very strongly.
Okay, thank you very much indeed. Deputy Crowe.
Good morning. Just a couple of questions. Some are fairly obvious, but in relation to your name, Christian Blind Mission, does that cause difficulties in some countries that you're operating in? Particularly ones where there's tension, sectarian tension in relation to people from different religious backgrounds. I'm just wondering, has that caused you problems in some areas?
You can just get to answer that and I'll come back to you then again.
Okay.
Okay.
You want to take that?
I would answer it causes mainly misunderstandings but not troubles or difficulties, which is a little different, because we always have then to explain that this is our roots and this is sort of our value base and our history as an organization, but that this does not mean we are not there to mission, we are not doing missionary work. That's the first thing, and we are absolutely working with, which means also amongst our own staff to start with, but also in terms of partners and projects we support. We don't ask people to be Christians or to have a Christian faith base. We are working with everyone. But that question comes up, as you also raise, Deputy, correctly, of course. But we have to explain that. But it's something which doesn't cause trouble or difficulties in the ongoing work.
Okay, Deputy Crowe.
Okay, the other one is in relation to, looking at the work you're involved in, inclusion, participation of people with disabilities, empowerment of people with disabilities, disability prevention and support, promotion and protection of rights of people with disabilities. See, in relation to those who have disabilities at home, again, do you have to explain to people who feel excluded from Irish society and that in relation to your work? I suppose it's down to this thing of, some people would say, well, we've enough of a problem at home, why aren't you addressing that, and so on.
I think yes, absolutely, and we are cognizant of that. I think the context we're talking about at the moment is the SDGs, which is both international and national. So the Irish government will be looking also in terms of creating a plan for Ireland. So that creates an opportunity around advancing the rights of people with disabilities through that. But equally, Deputy, I've met you in various different forums before as a campaigner for disability rights in Ireland. I'm quite proud of the fact that the Irish government fund overseas programmes that also include people with disabilities. I think to me it's not an either-or situation. I think that would be my view on that. Yeah.
Okay. Just on your work in coordination with the UN Agency for Refugees. Do you work, in that whole area in refugee camps to help refugees who have become disabled? The scale of the problem you're talking about, 1 billion people with disabilities, 80% live in developing countries in areas of high risk humanitarian. Do you work in fields like that? And many of those fleeing Syria, Iraq and Afghanistan have disabilities. Again, is CBM working with them?
Okay.
Thank you, Deputy. I think what we can say is we have been doing work in the camps around the area in the Middle East. However, the reality of the matter a lot of the time is that people with disabilities have been left behind in those countries where conflict is happening. So we kind of concentrate in the surrounding areas there where we can help, and that's the extent of our work there.
Okay. Your view on the UN Convention on Rights of Persons with Disabilities. In March 2007, Ireland signed but didn't ratify the convention, and since then it's been ratified by 156 countries. Are you satisfied with the Irish government's reasons for not having ratified this convention, or do you have a view on it?
Yeah, I can take that. Thank you, Deputy. Recently, the Irish government has set out a roadmap, so we are, in terms of the ratification of the CRPD, and it's as far as I'm aware, the latest is the legal capacity bill is still going through the House, and will be finalised. So I think everybody is eagerly awaiting for the ratification of the CRPD, but there has been a roadmap set out for that.
Okay, I can come back to you afterwards again.
Okay, great.
Deputy Mitchell.
Sorry, I missed the presentation. I had an earlier meeting, so I'm very much, but I have your presentation. I just want to state my support for your work and wish you continued success with your Irish Aid programme particularly, and I hope it goes well. And nice to see you here.
Okay, Deputy Sullivan.
Thank you very much, and I apologise I had to go back over. And again, to acknowledge the work of CBM. And I think for me, I had not realised the impact of disasters on people with disabilities until I went to the event that you had in relation to the Philippines. And it brought home in a very stark way how natural disasters, man-made or natural, whatever, the impact that they have on communities, but on people with a disability, it is 100,000 times worse. And I do think we're not as cognizant of that as we should be. I know you are very supportive and very appreciative, and all the work that you did, I'd acknowledge, in having disability included in so many of the Sustainable Development Goals. But we know that they're not going to be worth the paper they're written on unless we have plans and we can see implementation and monitoring. And I know there could be a difficulty if we just look at data by disability as opposed to disaggregating it. So I'd like to hear your views on that. You may have mentioned it already, but if you haven't, I do think it's important that we get the evidence, and anything going forward is going to be evidence-based. And if something is not working and if it's not achieving the goal that it should be, how do we stop it? And for me, it's regular monitoring, but very strict monitoring, and we need the data, very specific data on that. Thank you.
And maybe I'd add to that as well, Deputy Sullivan, you know, that the goals and the targets are numerous in the Sustainable Development Goals. Do you think they're achievable, and can they be met?
Iris, might give that to you.
I'm happy to take the difficult questions come to me. That's good as a rule. Well, how could I now sit here and say they won't be achieved? Obviously, I'm not going to necessarily say it, but well, your point, of course, is well taken. They are 17 goals and 169, if I get the number right, targets. Just the numbers tell us that this is going to be difficult to achieve and to make equal progress in all targets and goals. I think that goes without saying. We of course have to also look into the progress that we make globally and in overall towards achieving those targets. I think that's very important. Secondly, every country comes from a different starting point in making progress towards the targets. That also has to be, of course, differentiated in the monitoring, that Ireland, Germany, others don't come from the same starting point as Malawi. And that is, of course, the novelty of the SDGs compared to the MDGs, and that's great because it's global, it's universal. But of course, it makes the monitoring also pretty complicated and complex because it's sometimes difficult to compare. And it's not about comparing, it's probably about really tailoring them to the status of every country. Overall, last point, we have 15 years. It's a long time, and at the same time it's short in development, as we all know. So key will be, for me, to sustain the momentum that has been created around the adoption of the SDGs, not only in New York in September, but around those sort of dates, for the next, that we don't waste the next 5 to 7, 8 years. So the first half of the implementation phase is extremely critical, because that's often where it gets a little bit difficult to implement global frameworks. We are also satisfied now they are adopted. We've been working already for 2.5, 3 years on them, and that's not us, CBM, but all UN agencies, governments, and everyone has been working on them already for years. And then it comes often the point after the adoption where it's let's breathe a little bit, and then actually that's exactly not what should happen. The momentum has to be sustained, and so that the next years are critical to make the progress. That's as much as I can answer the question.
Okay, Deputy Sullivan, do you want to come back in that again?
Yes, one particular question for Mary in terms of funding for disability groups, the organisations here who are working and advocating for people with disabilities. You might like to fill us in on that, how happy or unhappy you are?
Well, Deputy, thank you, Deputy, for that question. I mean, I will always advocate for increased funding for disability organisations that are representative of disabled people, whether that's at home in Ireland or whether that's overseas within our international development work. Because ultimately, disabled people are experts for themselves, and we've come from a period of, I suppose, exclusion, and we're now at the table. So now is the time for support through funding and facilitation to make that a reality. Yeah.
Okay.
And sorry, could I just come back on monitoring and going forward? What is the best framework in order to look at the Sustainable Development Goals in terms of disability, and how we can ensure that they do work, that the framework is there? Are there frameworks in other countries that Ireland could follow? Because again, we have to see progress on these, otherwise, there's disquiet with Millennium Development Goals. I mean, how much do they actually achieve? Now we've got 17 of these Sustainable Development Goals, so I think it's even a bigger task. So it's so important that we keep an eye on and we monitor regularly if they're achieving, if they're not achieving, why not, and that we can move in a different direction.
I can answer that, Deputy, for you. Yeah, I think at the moment there's a growing consensus among a number of governments. So, say for example, UK Aid and also DFAT, the Department of Foreign Affairs in Australia, are looking at the Washington City questions, which are a short set of questions that can be applied to statistical surveys within country to gather data on disability. So at the moment there is investment going in also at a UN statistical level for that. So I think that probably will be the framework that will move forward. But again, because this is a global framework, different countries will have their different ways. But this appears to be the consensus at the moment that's moving forward. So there is progress on that, and I can give further detail. I can send you a paper on that if that's helpful.
Yeah, Chairman, I think it would be useful if we had those questions, so that we can pursue with the Minister for Foreign Affairs or wherever.
Yeah, thank you.
So you might come back to the Secretariat on that.
Yes.
Deputy Crowe, did you want to ask?
Yeah, just on Deputy O'Sullivan was talking about the Philippine situation, the tsunami there, and not the tsunami, the hurricanes and typhoons that were affected. And the main point you were making there was that. And that first of all, it was about awareness of people that had disabilities in that setting, and how vulnerable those people were, and the difficulties are post that that people trying to get from A to B and so on. So I think the message you were pushing that day was that whatever the response, that disability would have to be at the heart of that and part of that. How aware are the different programmes now in relation to that issue, and also in relation to the whole area of mainstreaming, and again, disability is unquestionably a development and poverty issue, and how can we better mainstream disability in the development process?
Okay.
Thank you, Deputy. Well, I think maybe to talk to the areas of emergency and disaster, there has been a Sendai framework that was developed at a conference around disability inclusive development or in disaster and risk reduction, and we had advocated for the inclusion of people with disabilities in that framework, and I'm delighted to say that there is specific reference to people with disabilities being included in all emergency response programmes, and that hopefully will merge together with the Sustainable Development Goals, and we will have inclusion throughout, both for sustainable development and in emergency. You mentioned the Philippines there, and we were delighted last year here to host a disabled persons organisation that we partnered with once the typhoon hit, and they were a partner we'd worked with for a number of years. And the importance there for us is that in that response they knew where the people with disabilities were, so they were able to access them. And that was crucial in actually saving a lot of lives. And they responded quite actively in that disaster, getting emergency supplies to people with disabilities, whether it be simply their medication or simply blankets, or getting them out of the situation they were in. So for us, it's not just about us delivering services to people with disabilities, it's about the participation of those groups. And we support a number of disabled persons organisations around the world, as do Irish Aid. And we think that's an important part of true inclusive development. And we think we're at a point in time now where we have a real opportunity for inclusion, for true inclusion. And not just, I think Lars mentioned there about the timing now. The time is now really not to wait for ratification decisions on indicators. Ireland has a very significant overseas development aid programme and has made significant commitments to people with disabilities. So we think we're at a point now where we really need to start measuring our performance around that, and that's where we would urge the committee to kind of build that into their annual review with Ireland in terms of our commitments, because there is a real opportunity. There are frameworks out there that can be used, and we think now is the time so that nobody is forgotten.
Can I ask you just one question more? Is there any country that stands out, or government that stands out in dealing with people with disabilities that has a really good programme in place, particularly developing countries?
Well, for CBM Ireland, we actually support a number of programmes in the Democratic Republic of Congo. And one key programme we have there is where we work with the Ministry of Health in a national programme to eradicate river blindness. And this is a very significant programme in that country. We will see there are some countries where river blindness has been eradicated through the distribution of medicine. And
the Carter Foundation, I think, is very good at that. The Carter Foundation.
Yes. So this is about where people can get access to medication which will actually save their life, and we're involved in a number of those programs around throughout Africa, and also in the area of neglected tropical disease. A lot of governments are taking it very seriously to help overcome that, to prevent disability as well.
Well, listen, if there's no more questions, we have a vote in the Dáil. If there's no more questions, then I want to thank you sincerely for being so open and frank, and I think dealing with every question and answering every question. And there was no answers, there was no questions that weren't answered. So I want to thank you sincerely for coming before the committee this morning and dealing with I think your presentation was really good as well. And what I would say is keep in touch with the Secretariat here. If there are any questions or issues that you need to raise, that we can raise in the committee here, we'd be delighted to do so, as Deputy Sullivan outlined there. Thank you very much. The meeting now stands adjourned until Wednesday the 9th of December at 10 a.m. in CR3. Thank you.